So we are have invited you for a blood test. We are doing lots of measurements on you. So what do these numbers all mean? Um, Hypertension or high blood pressure is often called the silent killer because there's no obvious symptoms. Most people with high blood pressure feel completely well, don't realize there's anything wrong with them. There's hidden damages. So while silent, it's steadily damaging your blood vessels, the heart, the brain, the kidneys, and the eyes. Um, there are really serious consequences to untreated hypertension. It's the leading cause of heart attacks, strokes, heart failure, kidney failure, and vision loss. So the only reliable way to know if you have high blood pressure is through regular blood pressure checks. So in other words, you can feel healthy, but high blood pressure may still be silently increasing your risk of life-threatening events. And that's why routine checks, even when you feel fine, are really important. So we pop a blood pressure cuff on. We have one in our wellbeing hub at the back of our waiting area, so you can measure your blood pressure anytime you're interested in. Most pharmacies you can walk into and they will also measure your blood pressure for free. Or you might have a cuff at home, or a friend or family member may lend you one as well. So we pump it up and it gives you two numbers. Those numbers, one is a top number we call the systolic blood pressure, and the other is called the diastolic. And so depending on how old you are, so we really have quite a big age range at the bottom there in the orange. Anyone under 80 years old, we're looking for a blood pressure. If we're doing it in clinic, if I'm taking your blood pressure, then it should be 140 over 90 or less, ideally. And if you're doing it at home, then we would want it to average less than 135 over 85. And when we ask patients to do blood pressures, we often will ask them to do a whole week's worth at home. So we can really look at what a typical week looks like to you, because we know that patients will get nervous when they come into the surgery and feel like they're being tested when they have a blood pressure cuff put on, so it often goes up. And something called white coat syndrome, and so it's much more reliable when you do it at home. So we would ask that you do it over 7 days, a couple of times in the morning, a couple of times in the evening, if we're concerned that your blood pressure may be elevated. If you're over 80, we allow the blood pressure to sit slightly higher, so 150 over 90 if you're in clinic, and 145 over 85. So they're the targets that we're aiming for if we consider you to be normal blood pressure, good blood pressure, or not at all. So HbA1c also reflects your average blood sugar over the past 2 to 3 months. So it's really key marker for long-term risk. So we can do a finger prick test that looks at what your blood glucose levels are right now, but this is a much, much more reliable predictor of what that's going to look like. On a bit like measuring blood pressure over a whole week, we're looking at measuring your blood sugar levels over several months. The green is the number that we're looking for, which is the normal. Anything below 42 millimoles per litre would be considered non-diabetic, totally normal. Then we have something called the pre-diabetic range. So you have a slightly increased risk, and it sits between 42 and 47. So you have a higher chance of developing type 2 diabetes and cardiovascular disease at this point. And so that's really when we want to be starting to think about interventions that we've talked about before, about nutrition and smoking and stress, and have an alcohol, and what are we doing, and are there things that we can do right now to stop it from elevating to actually full-blown type 2 diabetes. So that would be anything 48 millimoles per litre and over, and that would be diagnostic of diabetes. Diabetes, we know, can increase your risk of cardiovascular disease in several important ways. High blood sugar damages blood vessels. Over time, excess glucose makes arteries stiffer, they're more prone to fatty buildup, and it narrows and blocks blood flow. Raised cholesterol and triglycerides. Many people with diabetes also have unhealthy lipid profiles, and we're going to talk about that in a second, which can accelerate that arterial damage. Diabetes often goes hand in hand with hypertension, so blood pressure changes. So remember the figures we just talked about, which adds extra strain on the heart and the vessels. And long-term high sugar levels trigger inflammation that further injures vessel linings. Diabetes makes the blood more likely to clot, increasing the chance of heart attack or a stroke. So together, these effects mean that people with diabetes are up to 2 to 4 times more likely to develop heart disease or stroke than those without diabetes. So it's a really important screening tool. and we want to catch that early. Now, cholesterol there plays a real central role in cardiovascular disease. I'm sure you've heard that word before. Bad cholesterol, or LDL, can build up inside artery walls, forming fatty deposits, which are known as plaques. Over time, these plaques narrow and arteries become less flexible. If a plaque then breaks open, it can trigger a blood clot that blocks the blood flow, causing a heart attack or a stroke. Now, we also do have some good cholesterol, which is the HDL, which I'm calling the happy cholesterol, which is, so I can remember which is which. And it helps by carrying that excess cholesterol away from the arteries to the liver, where it's broken down and removed. So we want good levels of HDL and we want lower levels of LDL. But if we have low levels of HDL, which is the good cholesterol, then that can mean there's less protection. So we want to make sure that in men, that's above 1, and in females, it's above 1.2. High total cholesterol, so that's the figure there on the left-hand side, especially high LDL, is one of the most important risk factors for cardiovascular disease, but it's also one that can often be improved with lifestyle changes and medication if needed. So too much bad cholesterol clogs the arteries, while good cholesterol helps clear it away. So keeping that balance right is really key to heart health. So here we can see total cholesterol levels. This is the overall amount. So we're looking at LDL cholesterol plus the HDL cholesterol plus 20% of your triglyceride levels. In the UK, desirably, we would like it to be below 5, and if it's above 5, we would say it's raised. Now, the total cholesterol alone is not very useful because it's got to be interpreted alongside your LDL, your HDL, and your triglycerides, which is the TGs. So high triglycerides, high total cholesterol isn't always bad if you have a really high LDL, because we see that in some really healthy individuals. So then we want to really look at what's the total non-HDL levels, and that's going to give us a much better predictor of how bad the cholesterol levels are. That's the figure on the far right side. Now, LDL, low density lipoproteins, or the bad cholesterol, it's carried by LDL particles which deposit in the artery walls, contributing to the blockages. So we want those to be below 3. If they're between 3 and 4.9, we would say that was borderline high, and 5 or more is high. High LDL, we've now talked about, will increase your risk of cardiovascular disease in combination with other risk factors like smoking, diabetes, and hypertension. High density lipoprotein, or HDL, which is our good cholesterol, removes that excess cholesterol. We want that to be above 1 or 1.2 in females, as this is really protective. Triglycerides should be below 1.7. 1.7 to 2.2 would be borderline high. High would be 2.3 to 4.9, and anything above 5 or more would be very high. We know that sometimes if you have just eaten, then those triglycerides are going to ramp up after a fatty meal. So we want a really accurate, come in the morning when you have your blood test, and you might want to fast beforehand. So lipid panels should always be interpreted in the context of overall cardiovascular risk and not just in isolation. So those are the numbers that you want to be thinking of. And we're going to talk about now about some of the powerful things in addition to the lifestyle interventions that we already talked about that may benefit you further.